as the epidemic evolves, we find more like asymptomatic cases. If you recall, our community, getting community samples from the accident and emergency department as well as the general outpatient clinic started all the way from the 19th of February. So way back, we realized there are could be symptomatic cases in the community who may not required to go to hospital. So we started these surveillance. Of course, at the different stages of the epidemic development, we would roll out different surveillance programs. We also obviously have to consider the capacity of our public health laboratory and also our hospital authority laboratory, because, as I've said, at the different stages of development of the epidemic, there are different needs of testing. For example, when we have many cases and many close contacts, we do have to reserve our capacity for those cases to confirm the cases and to test the close contacts and to test the second specimen or within the 14-day quarantine period. Now, of course, when we have less confirmed case, we do have the capacity to do more testing in the community, especially the asymptomatic cases and also the high-risk asymptomatic cases. And this is also evolving because we have now found from science that there are more asymptomatic cases evolving. So that's how it sort of like roll out. So that's why we have now got plans to first increase the capacity of our laboratory in the hospital authority, in the Department of Health, Public Health Laboratory, as well as the two universities. So we have previously provided anti-epidemic fund to these, to the Department of Health, the Hong Kong University and Chinese University of Hong Kong, to boost the number of their laboratory capacities. Second is to expand the strategy, the testing strategy, and that is to go into the community. That's why I said earlier that we will be testing, or we have started testing airport workers. We will be testing workers of our elderly homes and also disability homes, as well as having test like distributing bottles at the 18 Chinese medicine clinics, tripartite clinics, as well as our district health center in Huai Ching. So I don't think it is too late. Basically, it is when the epidemic evolves, then we start rolling out further programs.